জি 24 ঘন্টা এক্সক্লুসিভ ডক্টর কোয়েৎজি ওমিক্রনে প্রথম আক্রান্ত চিকিৎসা করেছিলেন তিনি। রোগটাকে দেখেছেন খুব কাছ থেকে। ডক্টর কোয়েৎজির পর্যবেক্ষণ কি ওমিক্রন নিয়ে?
গত কয়েকদিন ধরে কোভিডের একটা শার্প পিক, কোভিড নাম্বারসের একটা শার্প পিক আমরা দেখেছি এবং বিশেষজ্ঞরা মনে করছেন তার পেছনে অনেকটাই দায়ী ওমিক্রন। এবং এই মুহূর্তে আমাদের সঙ্গে যিনি রয়েছেন সুদূর প্রিটোরিয়া থেকে, সাউথ আফ্রিকার থেকে, তিনি হচ্ছেন ডক্টর অ্যাঞ্জেলিক কোয়েৎজি, যিনি প্রথম এই পৃথিবীকে ওমিক্রন সম্পর্কে জানান এবং ওমিক্রনের অ্যালার্ম বেল বাজান। আমরা তার সাথেই এখন সরাসরি কথা বলবো। ডক্টর কোয়েৎজি, ওয়েলকাম টু জি 24 ঘন্টা again and thank you for giving us this time. First, I'll just get first to this question that you have seen the zero patient of Omicron and so far you have seen the disease throughout. So what is your finding about Omicron, if you can tell us that?
Good afternoon from Pretoria, and may your viewers have a blessed 2022. So again, we stick with the clinical pictures that we have seen. I know that a lot of the scientists doesn't want us to say that it's a mild disease. I don't know what they want us to say, but the majority of patients that you are seeing at primary healthcare level will have mild diseases. We know that the Omicron tends to get less pneumonia for patients, and the ones that are predominantly in ICU are mostly unvaccinated people. We also see that the people vaccinated that do get pneumonia are mostly the ones with, it's not a lot, it's less than, it's about 13%, but it's people with comorbidities. So it is important for people, especially over the age of 50, severely overweight, diabetes. If you think you have Omicron, go and see your doctor, get treated ASAP so that you do not progress.
Okay, some of the scientists are saying that Omicron is basically a blessing in disguise. Do you agree?
If you look at the mildest of the symptoms, and the fast way that this vaccine spread, or not the vaccine, this variant spreads. And then, yes, I think a lot of people will get nice antibodies. A lot of people will be infected without even knowing that they are infected. And going forward, that will protect them. However, how long our antibodies from natural immunity will help, it's not always sure. But the best is, if you can have natural immunity with a vaccine, that boosts your immune system tremendously. And that would be the ideal thing to do.
Okay, if we talk about the hospitalization, the severity, and especially the death rates of Omicron, comparing with Delta or the previous strains we have seen, what is your observation?
There's actually no comparison. If you look at the Delta deaths and you look at the Omicron deaths, and in Delta, we also look at the deaths that there was, deaths that was recorded during that time and not recorded whether it's Delta or whether it has anything to do with COVID. We saw a huge increase in death rate. Although, again, with Omicron, very low death rates, more or less around about 100 average. But does this mean that we are going to have a severe peak again? No, don't think so at all. I think this is the same thing that will happen in India as well. You know, once school starts to open, people go back to work out of the festive season, you will see a slight increase. But you are not there yet. You are still in where the numbers are doubling. We know it. Definitely.
And what is the oxygen requirement of the patients? What is the percentage? Do they require oxygenation or ventilation, if we talk about?
At primary healthcare, out of the 114 patients, 116, it's only those 2 patients that we had admitted. There's another one that we saw yesterday with a pneumonia. But again, we're still waiting for some tests to come back, but not acutely ill, so that she warrants ICU or even high care admission. So I'm waiting for that. So if I look at the patients and those other two that had been admitted, they were on normal oxygen. So the rest of all these patients that we have seen, none of them have been ventilated. None of them had needed any need for home oxygen, because that is also very important. No need. And that is the same picture my colleagues are seeing at primary healthcare.
Vaccination has any help in this whole Omicron situation, or the Omicron strain in itself very weak?
Okay, so again, what we have seen, and there's two scenarios, and that's why we keep on referring to primary healthcare. Primary healthcare is the first point of entry. It's your GP, your nurse. I'm not always sure how it works in other countries. But at that level, the amount of people, or the number of people vaccinated versus unvaccinated, are more or less the same that get COVID mild disease. However, what we have seen is that the vaccinated people's symptoms are less severe or intense than those not vaccinated.
Right. So India is currently witnessing a steep of COVID cases. Like numbers are going really high. The city I'm talking from, in Kolkata, we have seen in last 8 days the numbers has surpassed. The daily positive case has surpassed the previous 2 waves in just 8 days. So do you think that it's somehow in India, or specifically in Kolkata, the Delta is being replaced by Omicron, and that's why this steep case? And in this scenario, what Indians or we should do?
Yeah, again, remember, that's part of the nature of this virus is it's fast spreading. Okay, so I think it's important to understand that, because once if you understand that it's fast spreading, it's spreading via droplets, and part of it is airborne, then the precautionary measurements lies in the simplicity. So if you wear your mask is not going to protect you from getting it. Your mask is preventing you from spreading when you're speaking. So you will spread less virus. If you stay away from 1.5 meters, even if you can have it a bit more than 1.5 meters, it will make sure that for those droplets that escape your mask also don't affect the other person. And then good ventilation. And this might be a problem, especially in some of the third world countries where there's not good ventilation. There's not air cons or even normal windows. So for us, the best air con is an open window. So the other problem with real air cons is you can't control the quality of the air. And so much better if you can open up windows as much as possible.
And do you think that this spike is because of Omicron rather than Delta? Because this sudden spike we have seen?
Definitely. So what you try to do is because Omicron is fast spreading, you try to keep people with the mask wearing. That's the non-pharmaceutical interventions. Because what are you going to do? How are you going to? You will never get everyone vaccinated. But at least everyone can afford, hopefully, a mask. And those that can't afford, the government must provide. They must, help out there. That's how you're going to slow it down going forward. But it's going to spread like a wildfire for at least 2 weeks. And I think then you will start to see a slower uptake of positive cases.
Great. That brings me to the last question regarding children, because there are children who are getting infected these days, and parents are really panicking. So 2 questions, like what is the severity of the diseases when it comes to children? And number 2 is, does vaccination can help, or it has no role in that? Because some of the doctors, that internationally acclaimed doctors, they're saying that we should not hurry about this children getting vaccinated, rather than because they have a very milder disease in Omicron as well.
Yes, they do have a mild disease in Omicron. The majority of children, again, what I haven't admitted any child. I'm not aware of other doctors, but in the public sector, there might be children that's been admitted, but it's really the minority of the minority. It's not It's not a severe disease, except for those children who have immune compromised diseases or other chronic diseases. We're talking about the average child out there. So the average child out there, never forget that their immune system, up until around about the age of 6, are much more robust than our immune systems. As you get older, your immune system gets less robust. So these children are actually, they're more spreaders of the infection than it really affects them. So it is just that, please, the parents should not worry too much.
Great. Thank you so much. Thank you so much, Dr. Quetzi, for giving us the time for the second time. And we might get in touch with you again to find a way out whenever we need some help or some advice for our viewers. জি 24 ঘন্টা দর্শকদের জন্য এই ইন্টারভিউ আমরা এখানেই শেষ করছি। আমাদের সঙ্গে যুক্ত থাকার জন্য অনেক ধন্যবাদ, এবং একই সঙ্গে আমরা ধন্যবাদ দেব ক্লিয়ারনেটকেও, যারা আমাদের সঙ্গে ডক্টর কোয়েৎজিকে যোগাযোগ করিয়ে দিয়েছেন। আজকের ইন্টারভিউ এখানেই শেষ করছি। আপনারা দেখতে থাকুন জি 24 ঘন্টা। নমস্কার।